Hi, this is Stacy Lindahl, coming to you to do my health head-to-toe assessment. And my daughter here has agreed to be my assistant. This is Alyssa. So we're going to get started. Earlier when she came in, we had her get her vital signs done, height, weight, emptied her bladder, and she put on a gown. We also did the Snellen vision test. And I've washed my hands, and now I'm ready to begin. Have a seat. First, we're going to start with her head and face. I'm going to inspect the head to make sure it's round. There's no areas of bulging, lesions, any rashes. Now I'm going to palpate the head for any lesions. Bulging, masses, all sides look good, equal, no masses or lesions. I'm going to look at the hair. I'm going to feel it for fineness, coarse, and hers is smooth, which is normal. I'm going to make sure she doesn't have any alopecia going on, and she doesn't. Everything looks good. Then we're going to palpate her facial bones. We're going to feel if everything's intact, if you can feel any masses, any pain along there, and then we're also going to palpate the temporal mandibular joint to see if there's any pain or crepitus or locking there as well. All right, I'm going to have you open your mouth. Shut. Open again. Okay. All right, that's good. All right. And she didn't have any pain or crackling there. Now we're going to examine the mouth. We're going to have her open the mouth, and we're going to look in there with my pen light and looking at the teeth to see the color, if there's any missing teeth. And no chips, those sorts of things. Make sure her mucosa is pink. Looking at the soft and hard palate. I'm going to have you lift up your tongue to the roof of your mouth. Good. No signs of oral cancer. All right. I'm going to have you say ah. Looking at the tonsils. The uvula, making sure that's midline. Okay, you can close your mouth. Making sure it's midline. Everything is moist, pink, no cracking. There's no cracking around her lips or skin peeling. And then now I want to test for sensation. Actually, I want to do the jaw. I want you to open and close your mouth. Okay, I'll close. And then I want you to rotate your jaw side to side. Okay. Then I want you to stick your chin out and then pull it back. Good. All right. So she's got full movement in that joint. Next, I'm going to test her sensation on her forehead here with this Q-tip. Can you feel that? Mm-hmm. Now we're going to do the cheeks. That. Mm-hmm. And this cheek. Mm-hmm. And this chin. Mm-hmm. All right. Good deal. So that was normal. And it should be felt equally. Now I'm going to do the near vision test with the Rosenbaum test, which she's going to hold at her comfortable level and tell me what you can read the smallest line.
ACEUBD.
Okay, good job. All right, and that's good. And we're going to look at the eyes for eyelids for tremors, ability to open and shut them. I want you to open and shut your eyes for me. Okay, good. And then we're going to look at the eyelashes, make sure they're extending outward, the eyebrows are even over the eyes. The eyes are symmetrically set within the face. We are going to palpate the lacrimal duct, which is in the corner here, to make sure fluid comes out, and it does, and that's good. We're going to check the pupil constriction. I'm going to shine a pen in the light. We're going to look at the flora conjunctiva of the eye first. making sure that it is pink and moist. So I'm going to take a peek at that. Go ahead and look straight ahead. Okay, it looks pink and moist. Good. All right, now we're going to move on to checking on pupil constriction. We're going to have her look straight forward at the wall, and I'm going to look at her pupils using the pen light and look for consensual and direct constriction at the same time. So that way, make sure that both eyes are adjusting to light appropriately. Good. And those are both good. Okay. And so now we're going to do the cover-uncover test, which I'm going to have her cover one with a card and then uncover it. And we're going to see her pupil's response to when we uncover it to make sure there's no nystagmus or drifting and that the eyes are on one fixed point at the same time. Look straight ahead. Good. Good. And that's normal as well. Okay. Now we're going to take a peek at the red reflex. I'm going to get the otoscope. All right, I'm going to have you look straight ahead. I'm going to look into your eye here. And there it is. And that's just the light of the otoscope illuminating the retina. Good. Okay. And then next we're going to move on to the nose. That's it for the eye. We're going to look, or not the ears, I mean, we already didn't do the nose yet. We're going to move on to the nose. The ears. Let's do the ears. We're going to look at the ears. We're going to look at the positioning and the placement of the ears. We want to make sure they're symmetric on both sides. They're not placed low, which could mean a symptom of Down syndrome. Okay. We're going to palpate the ears. Make sure there's no hard nodules, and while I'm doing that, I'm going to look at the back of the pinout and make sure everything is intact. No skin tags or any lesions of any kind. No hard nodules there. And then I'm going to do the whisper test, which is going to measure her hearing. I'm going to come behind her, and I'm going to have her cover one ear, and then I'm going to whisper a word and have her tell me what I said. So I'm going to have you cover your right ear.
Orange.
Yep. Now I'm going to go on the other side. Cover your other ear.
Purple.
Good. All right, that's very good. Now we're going to do the Weber's test. I'm going to strike this tuning fork. We're going to place it on her head, and she's going to tell me when, whether she can hear it in both ears, or the right or the left. Okay?
Both.
Good. And that is normal. We're also going to do the bone to air conduction test to see if she can hear both of those. The air conduction, she should hear longer than the bone conduction, which is also known as the running test. So I'm going to strike the tuning fork and place that behind her ear on her mastoid. When you can't hear it.
No.
Okay, now I'm going to put it in front of your ear and you tell me when you can't hear it. No. Okay. All right, let's do this on the other side. I'm going to place it on your mastoid.
No.
And then your ear.
No.
Good. And that's all normal. We already did the whisper test. We're going to inspect the ear canal. We're going to look to make sure the stapes and the incus are intact. There's no fluid, no bulging. And that's tympanic membrane. It's pink and no complications. So we're going to start here with your right ear. Okay, everything looks intact. Now we're going to go with the left ear. And that looks good. Okay, so before moving on to the nose, I want to do one thing with the eyes that I forgot to mention. We're going to do the cardinal glaze. So I just want you to look straight ahead. I want you to keep your head still. And I want you to follow my I'll shut this off. I want you to follow my pen with your eyes. Good. And her eyes move normally as they should with following my pen. Okay, now we're going to go on to the nose. We are looking to make sure everything is smooth. We're looking to make sure there's no rashes on the skin, of course. We're going to look in the nose with the otoscope, looking at her turbinates to make sure they're not swollen, there's no redness, no inflammation. Her membranes are moist and her hairs are intact. All right, so I'm going to have you tip your head up a little bit. Good, on the other side. Good. All right, and that looks good from here. We also noticed at that point that her septum was midline. It wasn't deviated from midline, meaning that she had cleft palate or anything like that going on. Okay, I want to have you, or I'm going to close this side. I want you to take a deep breath. Blow it out. Any problems with that?
No.
How about now? Good. All right. Her nasal passages are patent. We are going to go on to okay, now we're going to move down to the neck. We're going to inspect the neck, making sure everything is midline. There's no rashes, lesions on the skin. We're looking for any bumps, protrusions, and I don't see any anterior. And we'll look posterior. I don't see any there. So that looks good. We want to make sure the trachea is midline. So we're just going to kind of feel. I'm going to have you swallow. Good. And that's midline there. We're going to go from behind. All right, I'm going to have you swallow again. Good. And that feels good as well. So moving on, we're going to start with palpation. You know, I notice there's no jugular venous dissension. So we're going to palpate her lymph nodes, starting at the preocular area. And then we're going to go from the pre to the postocular area, to the occipital. Then we're going to go up the chin to the submental and down the edge of the submandibular and down the posterior chain, feeling for the superficial lymph nodes. And then we're going to go to the deep lymph nodes, the supraclavicular. Okay, those feel good. And I'm going to have her hold her arms out. And I'm going to feel for the axillary lymph nodes. Good. Okay, you can put your arms down. Over here, we're going to have her do some range of motion on the neck. I want you to put your head down and back. Okay, and then side to side. Okay, and then I want you to push against my hand. Good. Sideways. Good. This way. And that's testing her strength. and her neck, her muscles. Okay. Now we're going to go ahead and do some cranial nerves, and I want you to close your eyes real tight, open them and wrinkle your forehead. Good. I want you to puff out your cheeks. Good. Stick out your tongue. Move it side to side. Okay. And I want you to shrug your shoulders. Very good. And those were testing the cranial nerves, and all those were intact. And that was very good as well. Now we're going to auscultate the carotids, and we're going to assess for broods. And we're also going to auscultate the thyroid gland as well. Just going to listen. And we're going to do them one at a time. Good. Good. Everything sounds normal there. No broods, no heaves. So now we're going to inspect the chest. We're going to look at her respirations, make sure everything is even, not labored, not working harder on one side than the other. We're going to look for the color of her skin. It's nice and pink. There's no rashes, no lesions that I can see. So that is good as well. We're going to palpate the pericardium of her heart. We're going to put our hand on her chest, and we're going to feel for the rate, rhythm. We're going to make sure there's no thrills, no heaves. And then we're going to move to the fifth midclavicular line and feel for the maximum point of impulse. Looking for the rate and the rhythm as well, making sure, if it's not deviated to the side, it's going to be located here. If it is deviated, it could be an enlarged heart. And as we go, we're looking for tactile fermetus. Now I'm going to listen to her heart sounds. We're going to start with the S1, S2 over here. Which is the aorta region. We're noting the rate and rhythm. And then we're going to move to the second intercostal space, left sternal border, which is the tricuspid, or the sternal border pulmonic area. Good, and we're going to move down to the tricuspid area. Got that wire on right now. And then the point of herbs. Good. And then we're going to listen at the fifth intercostal space, midclavicular line at the mitral valve area. No, that sounds good as well. Now we're going to listen to the lungs, and we're going to do it bilaterally to make a comparison. And we're listening for bronchi, wheezes, crackling. Maybe take a deep breath. Good. And again. Good. Again. I'm going to have you put your arms out to the side. We're going to listen laterally, again, listening for crackles and wheezes. Deep breath. Good. Good. And then one more. Good. You can put your arms down. And those are nice and clear as well. We're then going to move on to looking at the anterior chest wall as far as percussion. We're going to be looking for any dullness or hyperresonance, suggesting that maybe there is fluid or a collapsed lung in there. And that's good as well. Okay. Then again, we're gonna make sure that was bilaterally, and we're gonna percuss the lateral aspects as well. So I'm gonna have you put your arms out again. Good. And those are good as well. Have you put your arms down. And then we're gonna go over to the posterior. We're gonna look at the skin again to make sure. Have it turn.
This way?
Yep. We're going to look at the skin to make sure that there's no rashes, it's warm pink, nothing abnormal. We're going to listen to the respiratory sounds as far as on the back as well, bilaterally, listening for the crackles, wheezes, or bronchi. All right, I'm going to have you take a deep breath. And again. Good. Again. Good. And those are normal as well. Nice and clear. No crackles or bronchi noted. Then we're going to percuss the back of the fields, posterior field as well, looking for the hyperresonance or dullness as well. Good. And there's nothing abnormal about that right now. Now we're going to palpate the costovertebral angle, which is down here a little lower. So we'll just right there is where the sound is, but that's good. Then we're also going to look at this diaphragmatic excursion, which will tell us how well the lungs are expanding in that instance as well. So I'm going to have her take a deep breath and blow it all the way out. All right, right here is where we hear. Okay, then I'm going to have her take a deep breath and I'm going to have you hold it. Right there. Okay, go ahead and breathe. And it should be about 2 centimeters, and that is perfect. Should be 3 to 5 centimeters. And we're going to look at her breathing on the back as well to make sure there's no pulling or rising more than the other. I'm going to put my thumbs down here and I'm going to have her kind of cross her arms and lean forward a little bit. And then I'm going to have her take a breath. Good. You can relax. And that's just showing to make sure that her lungs are expanding evenly and proportionally without one side pulling more than the other. Now we're going to have her lay down and we're going to do the abdominal assessment. We're going to have her turn around and lay down and lift up her shirt to show her abdomen. We're going to look at the skin, make sure there's no rashes, lesions. We're going to listen to bowel sounds to make sure they're not hypoactive or absent. And that is good as well. And then over here, we're going to percuss, looking for any dullness or hyperresonance as well. And everything sounds good there. We're going to do some light palpation. Any pain? Okay. And we're going to try to palpate for the liver. We're going to do some deep palpation on the right costovertebral angle. And we don't feel the liver. That is good. We shouldn't feel it. Now on the left costovertebral angle, we're looking for the spleen. I'm going to put my hand under here and have you come towards me just a little bit. And we're pushing the spleen up and we're trying to feel, and there's nothing there, so that's good. Okay. And I didn't feel the kidneys, so we didn't feel any masses or any kind of organs that were enlarged or displaced, and we shouldn't feel any of those. Then we're going to have her sit up. And this is going to test her abdominal muscles, her strength of being able to sit up. And then we're going to move on to the musculoskeletal system. I'm going to have you hold your arms out in front of you. And I don't want you to let me push them down. Good. And then, good. And I'm also looking at her arms for any lesions, rashes, and I don't see anything there. Okay. And then I'm going to have you scooch to the end of the table here. And I want you to try not to push me away. Pull. And that's good as well. Okay. So then we're going to check your pulses. That is good. Try not to get in the camera way. Then we're going to check the pulses behind her knee, her popliteal. Good. And we're going to check her dorsal pulse. And then her posterior tibialis. And that's good as well. Awesome. Okay, now we're going to check her reflexes. Good. I'm going to have you relax. Alright. I'm going to have you put your hands together. Pull, 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 pull. There we go. There we go. Concentrating on the pulses. Now we're doing the Achilles. Good. And good. Alright. Then I'm going to have her stand up. I'm going to have her face the wall. I'm going to have her turn around and bend over. And we're going to look at her spine. Looking to make sure everything is smooth all the way from her lumbar to her cervical. And that looks good. And then I'm going to have you stand back up. I'm going to have you do a squat. This is showing how her muscles are strength-wise and the ability and flexibility to get up and down. Okay. And that's the end of our assessment. Thank you for watching.